It is the official start of summer and Memorial Day. It's right around the corner. And with all of that summer sun comes the chance for sunburn season for many of us. Well, small doses of sunshine are good for you. Just one sunburn can really put you at risk for skin cancer. And joining us today is Dr. Scot Ackerman, one of the First Coast's leading oncologists. Dr. Ackerman is a leader and educator in our community and brings over 20 years of experience. If he isn't in the office, there's a pretty good darn chance that you're going to find him out at a charity event giving back. And we are so thrilled to welcome you here to First Coast Living for what will be a weekly segment on health-related topics. Dr. Ackerman, thank you so much for being here.
Thank you, Casey.
Okay, so let's get right into it. This week's topic is going to be about our skin. Exactly, because we live in Florida and obviously we're going to be out in the sun a lot. When people think about skin cancer, they think it's one type fits all, but really there's a lot of different kinds of skin cancer.
Yes, there's different kinds of skin cancer. Some are more serious than others, and we generally split skin cancers into two categories. The melanomas, that we call the melanomatous skin cancers, and those are the more aggressive and life-threatening skin cancers. They have the potential to spread to other parts of the body and cause problems and can cause death. And there's other skin cancers that we refer to as the non-melanomatous skin cancers, like basal cell carcinoma or squamous cell carcinoma. These are generally a problem. They're treated very easily. They rarely spread or go to other parts of the body. But they can be serious and they can be life-threatening as well.
So there are a lot of parents out there who are thinking to themselves that they want to protect their children. They also want to protect themselves. So how do you prevent skin cancer?
Well, the main way to prevent skin cancer is to avoid the sun, avoid the sun's rays on your skin. There's other things that cause skin cancer as well, certain chemicals, ultraviolet light, those sort of things. But the main thing that we're exposed to all the time that causes skin cancer in America is the sunlight. And what you can do to minimize the sun's effects on your skin is to protect yourself from the sun. First of all, avoid being outside during the peak sun hours between 10 a.m. and 2 p.m. But we really can't do that. We all want to be outside, enjoy the beach and enjoy swimming and enjoy the river and those sort of things. So when you are outside, if you're outside during those hours, you want to protect yourself from the sun by wearing a hat, by wearing a shirt that has ultraviolet protection factor in it. A lot of shirts have that UPF in it, or to use sunscreen and use sunscreen as well. And
let's take a look at some of these because you're saying not all sunscreens are really created equal. First of all, what's the SPF minimum that we should have on our skin?
The FDA recently has said that the sunscreen companies cannot say that these products will reduce your risk of skin cancer unless the SPF is above 15.
Okay.
So these ones that are below 15, they won't protect you from skin cancer. They make it so you don't burn as much, but they're not going to protect you from skin cancer. So you want SPF above 15.
Okay, and then also the natural skin protection. That's a little bit better than the other types. Why is that?
So the more classic sunscreens have chemicals in them that we've recently found can actually cause cancers as well. Skin cancers and some other cancers. So in some of the lotions that have drugs like oxybenzone or vitamin A in them, those chemicals are absorbed into the skin and go into the body, and they could actually increase your risk of skin cancer. You want something that's all natural, something with zinc oxide. Remember, we used to put that zinc oxide on, was that white stuff on your nose or your lips?
Yeah.
That's
Thanks,
natural.
Mom.
right, exactly. You look terrible. But that's natural, and those things with zinc oxide are the best
Wow,
lotions.
That's some really good information. So pick up something that's an all-natural option. Okay, so let's take a look at our skins and think about for a second. If you think that you might have skin cancer or you notice something that's a little bit off, obviously first go to the doctor. But what are the signs that you could potentially have skin cancer?
Okay, we make it very easy to remember what to look for with skin cancer. So you want to look at moles or little blemishes on your body, and you want to remember your A, B, C, D, E's. Not ABCs, but all the way to E. A, B, C, D, E. And I'm going to tell you what each of these are.
Okay.
So here's some pictures we have up behind us. And on the left side generally is a non-cancer, a normal mole or freckle or something. And on the right is going to be a cancerous lesion. So the A we're looking for is asymmetry. Is the lesion symmetrical? The one on the left you can see is nice and round. There's lots of symmetry to it. The one on the right kind of scoots off in one end and another.
You can notice a big time difference.
Right, so that's asymmetry. B is the border. You want to look at the border and see if the border is smooth. A nice smooth border is generally benign, but an irregular border is it's concerning for malignancy.
Okay.
Okay. C is the color. Color, if it's a uniform color, those are generally benign tumors, but where the color is, where there's multiple colors in the lesion, like the one on the right where it's dark in the center and a little bit lighter on the outside, if the color changes, then you need to be aware that that might be something that's malignant. D is the diameter. Is the diameter growing? So if you have a lesion here and all of a sudden it's getting bigger in diameter, then you need to be worried that that might be something that's malignant. You see on the right, the much larger diameter. It's irregular. It's got lots of color too. And finally, E, the letter E stands for evolution or evolve. Is something evolving? It was something here you see on the left, a couple little spots, but then on the right, they evolve into two spots that kind of come together. So that evolution is something that maybe you want to think about. Go see your doctor. That might be something that's cancerous. You need to have it biopsied.
And obviously, no one ever wants to find themselves in that sort of situation. But if you do, what are the treatment options for?
Well, with skin cancer, the primary treatment option is surgery. And remove it surgically takes care of 99% of all skin cancers. But with skin cancer, like any other cancer, there's really 3 treatments that we look at with cancer: surgery, radiation therapy, and chemotherapy. Again, skin cancer, most of the time the surgery is used, but for larger lesions where the surgeon may not be able to get completely around it, we provide radiation therapy treatments for that. We do radiation treatments, and that is able to eradicate those larger skin cancers over 90% of the time. And unfortunately, in some of the more advanced skin cancers, like melanomas that spread to other parts of the body, we use chemotherapy as well. And chemotherapy is a drug that goes into the body and it attacks cancer cells wherever they might be in the body.
Dr. Ackerman, thank you so much for your insight and perspective on all of this. We appreciate it, and we thank you for sponsoring this, as well as Dr. Ackerman is going to be with us each and every week. And next week we're talking about what? Smart snacking? Smart snacking. Okay, and a little preview on what we can expect for that.
Well, we'll know what snacks help you keep healthy and what snacks you should stay away from, then you'll get obese with, and those sort of things.
Good tips to live by. Thank you so much. We appreciate it. And for any questions regarding this topic or any other health questions, visit firstcoastoncology.com and you will be able to confidentially submit your questions to Ask the Doctor.